Hello, everyone. My name is Bo Brockett. I'm the communications manager for the Michigan Environmental Council, and you're watching the Capital Connection webinar, where we connect you to some of the big environmental goings-on in the state. I'm joined today with my colleague, Ellen Vial, at the Michigan Environmental Council, and then Stephanie McKendry at the Healthy Homes Coalition of West Michigan. And we're here today to talk about something that is a long time coming in Michigan. It's been worked on for a long time, ending lead poisoning. This is a really big moment within this movement to do so, and I'm really excited to talk to you two today. So thanks for joining us.
Thank you.
Yeah, Bo, thanks so much for having us on.
Yeah. Well, as usual with these webinars, for folks in the audience who are new, you're welcome to post any questions you might have during the course of this webinar in the Q&A tab, or any sorts of comments and reactions you might have in the chat tab. If we can't respond to those questions or comments during the live webinar, I'm going to do my best to make sure I can follow up with you and get the answers or responses you need. And then if you're watching a recording of this webinar, I'll include like a little email in the description so you can reach out to us if you have any lingering questions as well. How about we start out with a bit of an introduction? Ellen and Stephanie are both brand new to the webinar series. Would you maybe mind telling us a bit about yourselves, the organizations you work with, and then kind of how you entered the lead space and began working in it?
Yeah, of course. So my name's
just going to say, let's start with you, Ellen. Yeah.
Thanks, Bo. Yeah, my name's Ellen Vial. I'm the Detroit program manager for the Michigan Environmental Council, which is a relatively new role for me. I was previously in the engagement team for about 3 years. I ended up working in the lead space because our former colleague Tina Wall took a job with the Department of Health and Human Services, where she's also are still working on lead issues. And so I have a public health background and took over the facilitation of the Michigan Alliance for Lead Safe Homes Coalition after Tina's departure. So I've been working on this issue now for about a year and a half, and so much has happened since I've kind of moved over into this environmental health space, and it's been just really riveting, and I've learned so much.
That's great. And Stephanie, how about you? Oh, you're on mute.
Sorry. Got ahead of myself. I'm Stephanie McKendry, the Director of Programming at Healthy Homes Coalition of West Michigan. So our mission is to prioritize children's health and well-being by eliminating harmful housing conditions. So I oversee 2 of our programs, specifically for folks living in Kent County that have concerns around lead, asthma triggers, and causes of accidental injury. We also have a program in partnership with the City of Grand Rapids to administer the lead hazard control program. So homeowners can receive up to $20,000 in repairs to reduce lead hazards in their home. So I've been with the organization since January of 2022, so I'm coming up on 2 years, so I'm fairly new to this space. But I've been working in and around housing issues in Kent County since about 2015.
That's great. Well, thank you both for joining us again. And Stephanie, I might, start off this conversation with you, just given that you have such a, like a localized, personalized view of lead poisoning in Michigan. I know that when I was in high school, when I was a high school senior, the Flint Water Crisis began back in 2014, and very top of mind among the state, among its community, and then even nationally as well. And then that similar sort of crisis came out again during the pandemic with Benton Harbor and Hamtramck. But as we'll talk a lot more about today, lead poisoning kind of goes beyond those 3 cities, as terrible as incidents as they had. I'm wondering, could you provide a bit of like this West Michigan perspective to kind of like this lead poisoning issue in Michigan, how it's affecting the communities and families there?
Yeah, definitely. So in Kent County specifically, over half of our housing stock was built before 1980. So we know there's a lot of older homes with potentially lead-based paint hazards in those homes, potentially older plumbing and fixtures in the homes that can cause additional issues. So there's a lot of potential risk to children and families in our area. We focus largely in zip codes 49507, 49503, and 49504, which historically those zip codes have the highest level of children that test with an elevated blood lead level. That's really where we try to focus our efforts to make sure that those folks are getting served, and those are historically underserved zip codes in our area as well. Also, something that's new and happening in our area, the Kent County Health Department, the state of Michigan, and the city is working to distribute water filters to eligible families in the community, because we know there are those older fixtures in their homes, that deterioration, the corroding can cause lead in the water in their homes. And we've heard, like, anecdotally from families that we're working with, especially since pandemic, a lot of folks are doing remodeling on their home. They're doing a lot of DIY improvements on their home, and they're, disturbing that paint, causing that friction. So it still is a very relevant and real issue for families in our area.
I think you made like a great point there, that even though lead was banned in a lot of products that we interact with daily, like paints, like toys, back in the late 70s, all those things still exist in our society today if they're not taken care of. And that's where, as you mentioned, where Michigan gets hit especially hard in that lead poisoning landscape, because we have so many older homes. I'm wondering, could you give just a little bit of a brief explainer as to like what some of those impacts lead poisoning has on kids and on families, like in terms of their physical and like developmental health?
Yeah, definitely. So for pregnant women, it can cause an increased risk of miscarriage, premature birth, low birth rate, all kinds of negative impacts on like kidneys and nervous system in the fetus. On children, it can cause developmental delays, lower IQ, hyperactivity, slowed physical growth. So there's definitely a lot of negative impacts that it can cause on children.
And it seems like too that a lot of those symptoms, I wouldn't, at least before kind of coming into this space, I wouldn't think I would have associated those with some sort of poison or like contamination. They could just be very well like things that I would have expected to have grown up with, like hyperactivity. That seems
Exactly.
really
Yep, we can try to easily explain it away with other things, like, because lead does impact each child differently. So the only way to know that they're being impacted is to have them tested. So
yeah. And I know I mentioned when I was in high school, that's when the Flint Water Crisis broke out. But once I was, began to work with great people like you two in this lead poisoning, space a little bit as a communications person, like I quickly realized, as you've both as you mentioned, Stephanie, that the lead poisoning isn't, necessarily isolated to certain places or to certain like socioeconomic backgrounds. I'm wondering if if you two have also experienced any sorts of like miscommunications or like educational barriers when it comes to talking about lead poisoning, which when you initially think about it, seems like something that might be something quickly feeding out into history, given that so many lead products were banned so long ago. Are you guys experiencing any sorts of those gaps? And maybe Ellen, we can kick it off with you this time.
Sure. Yeah. I mean, I think that there's just a broadly throughout the state, and I would imagine, throughout the country, because we don't use things like leaded gasoline anymore. We don't have lead in paint anymore. People only think about lead when there's a crisis, right? When Flint Water Crisis, Benton Harbor, Hamtramck. I know I have a lot of friends in Hamtramck who have, they have water filters now that the health department dropped off. And so these are the moments that we think about lead poisoning as a broader public, right? And I think that there's just a lack of education about all of the other unseen ways that people can be exposed to lead. And I think that in public health generally, that's a common problem, right? People think about something when there's an emergency or a crisis, but they don't think about it, think about how it could impact their families or their communities on a day-to-day basis. So I think as we move forward, or hopefully next year with universal lead testing, there will be a huge onus on health departments and advocates to make sure they're communicating to parents that this is, it's time for their kids to be tested for lead at ages 1 and 2, just across the board, right? This is like one of the best things that we can do to identify exposure points and remove the child from those exposure points.
So great. Thank you. Stephanie, do you have any thoughts on this space as well?
I think she makes a lot of good points. And too, I think people tend to think, oh, we're not, like you said, using leaded gasoline anymore. Or lead was banned in paint. So why is this like still a consistent issue? But you think of now all the interest that people have in like vintage items, right? Or like thrifting, all that kind of stuff. Like you mentioned, old toys that, grandma or grandpa might pull out of a box to give to their kids. And it doesn't even cross their mind that there's potential hazards in those items. So like you said, a lot of the upcoming legislation and policy is very important. Hopefully it reignites the importance of these issues in people's minds.
Yeah, definitely so. And to go really quickly to your point about crises, Ellen, I heard or read somewhere the author had kind of framed a crisis as as the point where so many failures had happened beforehand. Like that was the end result. Like it's like a series of failures that lead up to the crisis. And that's how we get terrible things like the Flint Water Crisis in Benton Harbor and Hamtramck. I know that both of you are working within coalitions or working within organizations to prevent those crises from happening in the first place. Could you tell me a little bit about some of like your coalition or coordinating work that you both do in your two separate roles? Stephanie, maybe from your end, how you're working with community members, in West Michigan specifically, and then Ellen, maybe through the Michigan Alliance for Lead Safe Homes.
Definitely, we provide a lot of education to different providers, especially those that work with young children, those that do home visits with families. They have their eyes on the homes in places that we might not be, or can make connections that maybe we are not having made yet. So they're really important partners in this work. We work really closely with our local health department. They are a great partner, and we work on spreading consistent messaging throughout the community. So we're all saying the same thing, we're on the same page. And I think showing that unity is really important as well.
That's great.
And yeah, the Michigan Alliance for Lead Safe Homes is a coalition of advocates, county health departments, contractors. We've got reps from the state health department as well. So it's been around for 13 years. Universal lead testing has been its #1 policy priority since its inception. And it's a place where we meet monthly, virtually, and it's a pretty cool space for folks to share like new programs they're working on. Like Stephanie mentioned the filtered distribution program in Kent County, so we get to hear about that at our MyLesh meetings. We get to hear how DHHS is planning for the universal lead testing rollout, and grant opportunities that are coming down the pike from HUD, from the federal government and from the state government, and strategies to educate community and to educate our lawmakers as we kind of see some of these bills move through the legislature too.
Yeah, you gave us a great preview, Ellen, about some of this great stuff to come. We've kind of have set the scene of sorts. We've talked about lead poisoning a bit historically, a bit in a macro sense. I'd love to turn a little bit towards some solutions that both our organizations are working on from the education and advocacy standpoint. Because as we maybe have alluded to earlier, this really is kind of a big moment in the movement. And Ellen, maybe let's start off with universal lead testing. Would you maybe mind talking a bit about what this policy is and where it's at in the Michigan legislature?
Yeah, absolutely. So universal lead testing is the phrase we use to describe a policy that requires all children in a state to be tested for lead, regardless of kind of what healthcare coverage they're on. Right now in the state of Michigan, we only require kids on Medicaid or CHIP to be tested for lead. But as Stephanie mentioned before, there are so many homes in our communities that were built before 1978. So I can't, in Grand Rapids, you said it's 50. That's crazy. I mean, that's so high. And so if you think about all of our older communities, like, Detroit, Grand Rapids, Saginaw, Flint, and their inner ring suburbs, right? All of these, the housing stock, a lot of it is, pre or post-war era, right? So there is lead paint in those homes. And I see Mary Sue asked a question in the chat, where's the number one place in a home that kids can be exposed to lead? And that's in the windowsills and door frames, anywhere where you've got layers and layers of paint on wood that can chip off and expose the lead paint that's underneath. So we know basically that we're missing kids who have lead exposure, right? There are plenty of kids who live in old homes who are not on Medicaid, who are being exposed. And, recently the EPA lowered the elevated blood level standard to 3.5 milligrams per deciliter. Someone correct me on that if I got it wrong, deciliter. And so, that's come down precipitously in the last few years, right? So it doesn't take much for a kid to hit that 3.5. And so implementing a standard of universal lead testing in all children at ages 1 and 2 will help us identify kids who are being exposed to lead way faster and make sure that we can connect their families to resources to remediate that exposure. So a little bit more about into the weeds of the policy. Basically, it requires the child to be tested at 1 and 2, and that goes on their immunization record. If there's no record of them being tested at 1 or 2, then they would be tested between the ages of 3 and 4. And then there's an additional, any kid who lives in an area that is identified as high risk, so places like Detroit, Grand Rapids, those inner ring suburbs, would be tested a 3rd time.
That's fantastic. Oh, go ahead, Alan, I saw you.
Oh, I just realized you also asked me where this is in the legislature, and that's the exciting thing. So it's passed both chambers and has been presented to the governor, which means she has 14 days to sign it. So we are expecting a bill signing very, very soon. So I know I'll be watching my inbox all day for press releases from the governor's office to find out if she did it or not.
That's fantastic. And yeah, I have to take a moment to just really give a whole bunch of kudos to the Michigan Alliance for Lead Safe Homes. I joined the coalition 3.5 years ago, but I know, this fight has been going on for, 10 years extra in addition, to that. And there's been some just amazing folks across the state who've been working on this, from the UP to Grand Rapids to Detroit. It's been really great to see. And I got to give a special shout out to a lot of the parents and grandparents of lead poisoned kids who have just been willing to go to Lansing every year and educate lawmakers, or hop on a press release or talk to reporters. That takes a lot of courage to talk about such a personal issue, and to do it just so willingly. So a huge shout out to that crew. Stephanie, I'm wondering, maybe is this something that I take it this is something folks are really excited about on a local level? Could you talk about what the feelings are right now around universal lead testing, and maybe what this could mean on the ground, so to speak?
Absolutely. I think it's so exciting. I know at the office, we've been celebrating. We're so excited to see this change happen. It's much needed. And I think we've talked a lot about in our community, we're so reactive, right? So how can we move to be more proactive? So I think Ellen made a good point of, we're testing kiddos at 1 or 2. Hopefully we can catch it, when they're young. And then what can we do to help get them connected to resources in their community that can help like lessen the impacts on the child, connect them to resources that can make some repairs and modifications to their home, all of those exciting things. So there's a lot of good buzz going around right now. Everyone's really excited.
That's great. And I like that point too of not only will universal lead testing get more kids tested and thus more kids treated early on before the symptoms created by lead poisoning become, very strong, but it also is a great way to get us to help us find out where that lead poisoning is coming from. I think I really like that thought. And maybe this fits well into another piece of legislation that's not as far as universal lead testing, but will very soon should be. And that is kind of what's kind of dubbed as the filter first approach. If you're subscribed to the Environmental Council newsletter or follow some social media, like universal lead testing, this is something we're talking a lot about. And that's because we really do think it will have like a transformational impact on this fight to end lead poisoning. Ellen, could you give us, again, like a little bit of an explainer of sorts around this policy and again, where it's at?
Sure. So lead has been detected in water systems and schools across the state at some alarming levels in the last, I'm not sure how long they've been testing. I know that in Detroit, we were detecting pretty high levels of lead in a lot of the school buildings in the last decade. So this filter first policy basically skips all of the testing and goes straight to installing filters in school drinking fountains. So it's a filter that filters out lead, and it has I'm not sure if they've decided on a contractor filter installer, but a place where you can fill up your water bottle or drink out of the drinking fountain. So it's removing any possibility that a child would be exposed to lead from drinking water in schools. I know that Detroit and Ann Arbor have already done this in their school districts, and so now this filter first policy would ensure that kids all over the state in other communities also have this extra layer of protection. And it's one of the reasons for doing it this way instead of testing throughout the year and stuff like that is because you're not always getting an accurate test when you test the water. Like there's different concentrations or amounts of heavy metals or particulate matter that could be flowing through the pipes at any given time. And thank you, Cindy. The bill also covers childcare centers. So it's important to, so like coming back from summer vacation, right? The pipes haven't been used in 3 months. You're going to get a different reading than if you tested the water in the middle of the year. So it would take so much testing which is something that doesn't give you necessarily the most accurate read or understanding of what's in the water. And so it's ultimately more efficient to just do the filter first.
That's great. And it's great to know too that it's just as effective, right? It can eliminate that threat of lead poisoning just as much as replacing potential portion of like that water infrastructure. But you could do it on a much quicker and more affordable scale. One thing that I really like too about that filter first approach is that while we're still kind of, the lawmakers are still working out sort of the final kinks around this, there's also going to be like funding for this too. So schools aren't going to have to just foot an entire bill on this as well. We actually have, as of right now, $50 million set aside to help install these filters across the state, which I think is great. And it's great to know that like we already have that, like that funding was secured last year. So this is just getting the actual like mechanisms in place So I'm sure that's a great incentive for lawmakers. You already have this money set aside. Let's do something with it now. That's great. And I want to point out too, some research done by Elin Batanzo of Safe Water Engineering. We've talked a little bit about how lead in homes is like, homes are the most prevalent source of lead poisoning in Michigan. And it's very much true. But some of Elin's own research using some public data around voluntary water samples sent in from school districts to the state of Michigan have shown that there's the majority of those school districts had some trace levels of lead within their water, if not a very concerning level. So this really is a big issue, and it's going to be great to hopefully see that relieved within the next few weeks, hopefully. Stephanie, I know you're very much homes based with your organization, hence the name Healthy, like the Healthy Homes Coalition. But I imagine too that this is still something that folks over here in West Michigan are going to be very excited about as well, right?
Oh, absolutely. I think it's another good example of trying to get ahead of the issue, before it impacts children, because you think of how many months of the year they spend in school, compounded that through, all of the years that they spend in school, like all of the potential damage that could, do to their bodies, their brains, and their development. So yeah, like Ellen said, maybe not having, testing throughout different times of the year, you're going to get different responses. So just like going completely around that, just do the filters. That way, the water is safe and healthy for the kiddos.
Definitely so. I know we're getting close to the hour mark here, but I want to make sure we give us space to talk about some other stuff that's going on, because while these two sets of policies, universal lead testing and filter first, are definitely great, there's actually a lot of other stuff kind of in the works in the legislature and beyond. Would both of you or either one of you talk about some of these other things that you're looking at, that are on the horizon?
Sure. There's another bill in House Health Policy right now that we've been referring to as the RRP bill, the Renovate, Repair, and Paint Rule bill. So that's a program that's administered through the Environmental Protection Agency that trains painters and contractors how to properly address lead paint in a home, make sure it's either completely covered or removed. So painters in the state of Michigan, any painter is supposed to get certified through this RRP rule. But since it's administered by EPA Region 5, which is based in Chicago, we don't have a lot of power to make sure that people are actually getting certified through that program and maintaining their certification. So this new bill would basically move that program out from under the EPA and up under DHHS. So we would have a little bit more local control over that program and make sure that painters in the state of Michigan are educated on issues of lead paint and how to remediate them. So I think, in some ways with the passage of universal lead testing, like the work has only just begun, right? It's like, this is such a big victory, but it also means that we're going to start identifying a lot more kids that have elevated blood lead levels. So it's really important to make sure we basically have like a wraparound policy that addresses the needs of families as we identify more kids with elevated blood lead levels. So making sure that we have trained contractors and trained painters is really important. And making sure that our county health departments have resources for them and that the state is in a position to provide support to those county health departments is really important. So another thing that we are anticipating in the next couple of weeks is a bill that would levy a 25-cent tax on a gallon of paint sold in the state of Michigan, which is really low if you consider the cost of a gallon of paint, which runs like $40. So it's 25 cents per gallon of paint. And this tax levied would go towards helping remediate and repair exposed lead in housing. So these are a couple initiatives that will help us kind of create that like wraparound structure needed as we identify more kids with elevated blood lead levels.
That's fantastic. I like that perspective of a wraparound method, because you're right. Theoretically, this universal lead testing approach is going to really put some pressure on us as a state to properly not only treat kids who are lead poisoned, but also knock out the places where they're getting poisoned. That's a fantastic perspective. I'd like to just maybe finish very briefly. We've talked about these big, bold goals. And we've also talked about how, way back in the late 70s, lead paint was banned, and that was a big win then. Where do you feel this moment right now could potentially be, placed in terms of like the big moments in the lead poisoning fight? Is this how do you view this moment in kind of in place in history and in the future?
I would say, I think this is huge for Michigan. There's only 10 states in the US that require universal lead testing. And I think this moment, universal lead testing and then these other initiatives that we've talked about today will really mark us as leaders in the lead poisoning prevention space. And I think that's really exciting and worth celebrating.
That's great.
Couldn't have said it better. Yes.
Well, great. That's perfect then. Well, with that then, Stephanie, Ellen, thank you both so much for taking part in this webinar today. I feel like we could keep on talking, but we're unfortunately a few minutes over, so we're going to have to shut it short.
Thank you so much.
Yeah, thank you, Bo, and thanks everybody who joined us.
Yes, second that, definitely so. To those in the audience, you'll get an email from me in the near future with a recording of this webinar, with some resources that we might have mentioned offhand during this webinar, and then answers to some outstanding questions that we couldn't get to in time. So keep an eye on your inboxes for that. And for those watching a recording, those resources, again, should be in the description. We'll have like links to those things down there. From the Environmental Council, thank you. Thank you, Stephanie, in the Healthy Homes Coalition of West Michigan, for attending today and for, helping out this lead poisoning fight over in your corner of the state. And with that, we'll say farewell to everyone. Take care.